Hi, my name is Ryan O'Hara. I'm a PA in the Immersion Department at High Point, North Carolina, and today we will be talking about improving throughput in the Immersion Department in High Point, North Carolina using a quality improvement project process. So let's talk a little bit about what the project is and a project overview. So developing a super track area within the High Point Medical Center Immersion Department is kind of the overall goal. So what is a super track? So a super track is a area within the Immersion Department where there are 6 beds in one procedural room where a APP, usually a PA or a NP, can go and perform quick throughput measures such as ankle sprains, coughs, congestions, things that typically don't require very much imaging or labs in the emergency department. Typically, they're called level fours in the emergency department, as well as perform a provider and triage using 2 of the beds. So what a provider and triage is basically you tell people that you're coming back here, you get a quick history, a quick physical exam, and then you have them go back out to the lobby, and then you can order labs and imaging that the nursing staff can't. It just helps improve throughput and have more things that are waiting for them in the back when they're finally picked up. Typically, these are staffed, like I said, by APPs, a nursing person, as well as a radiology tech will obviously be involved with this, phlebotomy, and then a nursing leadership. So those are also the stakeholders as well for this project. The definition of the system is within the hospital itself, with hopes to expand to the actual hospital system throughout the Wake Forest Baptist Health System. But we will first start with just specifically the High Point Medical Center campus ED. So like I talked about, the ED providers and ED nursing leadership, imaging, as well as registration are also important for this, and hospital leadership. Those are all the stakeholders. So how do you conceptualize the ED throughput? There's a lot of different models. This is one of the ones that I prefer and makes a lot of sense. You go from input to throughput to output. Input being your referrals from other offices, your ambulances, your self-referrals, as well as obviously calls for a lot of telemedicine, especially with COVID coming so apparent now. There's been a lot more telemedicine visits, and now they're sending them to the emergency department from the phone. Throughput, so that's from when they check in, from triage to treatment, assessment, all of your imaging, and then stabilization to when output, where you decide where are they going. Are they going home? Are they left without being seen? Are they unfortunately passed away? Are they getting transferred? So all these are timed. So why does this matter? Why are we doing this project? So overcrowding in the emergency department is a major problem for staff, for patients, for hospital systems. It's a major stress. A lot of the times, whenever you have a worsening throughput, it's low, patient satisfaction goes very strongly down. It decreases your productivity as a patient and staff, causes poor morale, decreased quality of care, which is one of the most important ones, obviously, as well as decreased staff-related outcomes. So how do we achieve our goal? So to achieve our goal, we have to know where we're coming from, and we have to identify the root causes. So we're using the fishbone model, which is a structured brainstorming tool to achieve a desired effect. So as you can see here, I've listed out and focused on the people, the materials, the methods, and the environment. I'm not going to go specifically, in each one, but this was just my brainstorming process to improve the ED throughput, and it breaks it down into as much as you can, and for what I could come up with under these categories. So what are our themes for our improvement? So first, what is the problem? Inefficiencies in throughput within the HPMC ED cause poor patient outcomes and patient dissatisfaction. And it's undertaking this project to improve the ED workflow and throughput so that staff morale and patient care can improve. And then our aim statement is the goal of this project is to improve ED throughput by decreasing left without being seen rates by 50% and door to disposition times by 30 minutes to improve patient safety and satisfaction by April 2021. And these are measured using timestamps within the EMR system. So implementation tools, systems. So the big thing is first we collaborate with our stakeholders. We come up with ideas, as well as we reorganize once we've come up with those ideas. We act, we start this, as well as implement this, and then we monitor, revise. We get feedback from the people who are on the front lines doing this, And then it's a system. It's a recycled system. We keep doing this and we keep improving until we feel like it's a fully functioning system and it does improve health. So an improvement process that we're going to do is the PDSA cycle and the model for improvement. And this is one of the major things that's very important to this project. So we're asking what are we trying to accomplish, how we know that the change is improved, and then what changes can we make as a result of the improvement. And as you can see, again, it's a cycle. We do this and then we start to plan, we study, and then we act, and then it's another cycle, and we continue to do this. Our timeline, end of August 2020, project proposal, September, storyboard, at the end of September, project video, October 1st to January, we're rolling out the project. April 1st, we're reviewing the data we have from October to April, and then mid-April to early May, we're looking at this, we're compiling our data to make sure that everything aligns as well as plan to produce this data to other hospitals. So the management skills that are needed, conceptual skills, interpersonal skills, decision-making skills, as well as diagnostic and analytical skills. These are the core 4 reasons why I think that these stakeholders need to obtain to make this successful project. So the steps for success. The initial steps, creating an area in the ED, gathering the supplies, discuss the project implementation, discuss why we're doing this, which is very important, as well as decide launch day, obtaining data for the review weekly for every 2 months and then monthly, and then changes made 4 months into the program for feedback, ideas, and revisions. And our hopes and goals are to present the findings to the Emergency Medicine Journal publications using the Squire 2.0 and discuss with other EDs within the Wake Forest system, and hopes to create this and other systems. And here are my references, and thank you for listening.